Hi everybody and welcome to my channel. Today's topic is about esophageal cancer. So there are two types of esophageal cancer that can occur to any patient. It can be either adenocarcinoma or squamous-cell carcinoma. Although there are other types like myoma, but they are very rare and you will not likely find them. So, what is the difference between adenocarcinoma and squamous cell carcinoma? The main difference is in the histologic pictures. In adenocarcinoma, the tumor is taking glandular shape. However, in squamous cell carcinoma, it's just composed of squamous cells or keratin in different shapes. This is the main difference. We will but this is just an introduction. I will go through it with you to get an idea about the difference between these two types of cancer. For squamous cell carcinoma, it's usually in the upper 2/3 and it's not related to gastroesophageal reflux disease, unlike adenocarcinoma. And it occurs in the lower third because it's actually associated with gastroesophageal reflux disease or Barrett esophagus. And as we know that these two types of diseases usually occur in the lower esophagus. Also, obesity, smoking, and achalasia can be risk factors for adenocarcinoma. We have alcohol consumptions, hot liquids like tea, strictures, smoking, and achalasia. And you should know that squamous cell carcinoma is not related to GERD, it's just genetic and related to lifestyle changes. For the prevalence, adenocarcinoma is very common in America, and for squamous cell carcinoma is common worldwide, especially in developing countries. Let's start with adenocarcinoma. Again, you have the very important risk factors, which is esophagus. You have smoking, obesity, hiatal hernia, and very important to know that it occurs in people with diets lacking fresh fruit and vegetables, which means that diet that lacks fibers. And as you know, the Western diet lacks fibers, as in the United States. This is why adenocarcinoma is very common in America. Also, diet that is rich in red meat, and again we have GERD. So what is the pathogenesis? What happens at the molecular level? So there is a stepwise acquisition of mutations that can progress from metaplasia, dysplasia, and finally cancer. So when there is a continuous inflammation and the lining by acid, this can damage your DNA. And if you have a long-standing disease, you continue to get mutations that progress from metaplasia, dysplasia, and finally invasive carcinoma. And the most important genetic mutation in patients with adenocarcinoma is a mutation in the gene EP53. It's a tumor suppressor gene that is responsible for suppressing the cell from progressing to the cell cycle. So if it's mutated, the cell can progress to the cell without stop. Also keep in your mind that it's associated with other types of mutation, but this type of mutations occurs in most of patients who have adenocarcinoma. The presentation, usually it's discovered very late when the tumor has already traveled to other parts of the body. It's usually related with progressive dysphagia, which means that the patient first suffers from dysphagia with solids, but then liquids. This is because the tumor is growing inside the esophagus till it blocks liquids. It's also associated with weight loss, and this type of cancer has very poor prognosis because it's usually discovered late when the tumor has already traveled. Also keep in your mind that it also has a very aggressive course, because hopefully you know from your histology that the esophagus lacks the serosa lining, so it allows to a rapid extension of the tumor to other parts. For the morphology, it has three shapes. It can either be exophotic masses, or infiltrate diffusely, or ulcerate and invade deeply. And here is a diagram that shows you. Here is we have cancer cells. They are adenocarcinoma. They haven't yet invaded the lining and traveled to the lymph nodes, and they are usually asymptomatic. They don't produce any symptoms till it's too late. And this is called carcinoma in situ, because we have cancer cells that has the ability to invade but haven't yet invaded. Now it has invaded and spread to lymph nodes, and actually this is when the patient comes to you has previous symptoms. Moving on, let's continue with squamous-cell carcinoma, the other type of cancer. It's very common in the developed countries, as I told you before. It's not associated with gastroesophageal reflux disease. It's not associated with gastroesophageal reflux disease. It's related to lifestyle and genetics, and it's usually in the upper 2/3, as we see here. Unlike the adenocarcinoma, which occur usually in the lower third. And this type of cancer spread to lymph nodes first, and the most common two places that it travels to are the lungs and the liver. For the pathogenesis of squamous-cell carcinoma, there is no specific molecular that the scientists have found. However, they have found that associated with lifestyle choices, as I told you before, like alcohol consumption, smoking, nutritional deficiencies, and nitrosamines. And you may wonder what is nitrosamines. And nitrosamines are some compounds that exist in fried food. So if you consume big amounts of fried food like French fries, this increases your risk for esophageal cancer, and by the way also increases your colon cancer. And other mutagenic compounds, such as fungus contaminated foods. As we know, there is a fungus toxin called toxin, and it has the ability to cause hepatocellular carcinoma, which means cancer in the liver. So there are other types of fungus toxin that can cause cancer in the esophagus if they are consumed. For the presentation, again, it's very similar. The patient comes with progressive dysphagia, weight loss, and they have enlarged supraclavicular lymph nodes, as we see here. Here is the supraclavicular lymph nodes. They are in the neck. For the morphology, it's very similar to adenocarcinoma. It may be polypoid, ulcerated, or diffusely infiltrated. And here is what it looks like under the microscope. As we see here, the main characteristic feature of squamous-cell carcinoma is keratinous pair, and it occurs in most types of squamous-cell carcinoma. You may find it also in squamous-cell carcinoma of the skin. And again, as the previous diagram, here you have cancer cells that haven't yet invaded the mucosal lining. Squamous-cell carcinoma, it's called carcinoma in situ. Cells have the ability to invade but haven't yet invaded, and here they have invaded to lymph nodes, and they can travel to the rest of the body. And this concludes our video on esophageal cancer.